Greetings and welcome to another episode of Living in Victory Every Day. I'm your host, Gwen Goolsby Tillery, and today I want to come to you to talk about a very serious issue within the African American community, and it deals with our mental health. September is Suicide Prevention Month, and I just want to share some tips and some information with you regarding suicide within the African American community. According to the African Association of Suicidology, and this data is coming as of 2016, African Americans died by suicide in the U.S., and of these 1,946, 80% of them were male. The overall suicide rate per 100,000 was 5.46. In 2014, there were 475 African American female suicides in the U.S. The suicide rate of African American females was the lowest among men and women in all ethnicities. In 2015, researchers released data showing that there were more suicides among African American children ages 5 to 11 than among Caucasian children. This was the first national study to show and observe higher suicide rates within the African American community over Caucasians in any group. And so I just want to come to you and just talk to you a little bit about specifically suicide, but overall just mental health wellness within the African American community. There are so many things that we have to deal with within our community that create stress and create worry. As we know, over the last couple of months, we've been protesting and we've been shedding light on the fact that within America, African American males specifically have to endure so much. And when we think about all that they have to endure within this country as it relates to racism, as it relates to police brutality, as it relates to financial issues and situations, we can understand why there would be so much pressure put on our African American men, and as well as the African American community overall. It is a very alarming statistic to me that our African American children are actually committing suicide at a higher rate than Caucasians. And so this is an indication that our children are enduring a lot, and that we in the community of African Americans really need to take a longer and harder look at our mental health and really prioritize it. And so I just want to give you some information as it relates to some of the things that actually can cause some issues and triggers with our mental health. So as an educator, I would often explain to teachers that would really get upset with students that come in and wouldn't be prepared for class, or, had a certain look about them, that you have no idea what these children have to endure just to make it into the building. And I know we've heard the term PTSD, and sometimes it's just kind of thrown around. But the reality is that when we think about what some of our children have to endure on a daily basis, walking to school, having to worry about who they might encounter on the way to school, having to duck bullets depending on what community that they live in. Many of them are suffering from what I would say would be PTSD without even recognizing it and knowing it. Post-traumatic stress disorder is something that occurs as a result of traumatic or ongoing traumatic experiences. Our children are going through, some of them, very traumatic experiences, and we need to look at the signs and the symptoms so that we can make sure that we get help for them. So if you have a child who changes the behavior, if you have a child who all of a sudden seems depressed, if you have a child who starts saying things like, I don't matter, those are signs that we need to be aware of. And let me make this very clear. It does not make you weak to go and seek mental health. It makes you wise and it makes you strong. And so the same thing for our African American men. They endure so much. And so when you see a change in behavior, be aware of these changes and know that it's okay to go and seek help. Some of the other examples and factors that put African Americans at a higher risk for suicide or suicidal ideation, psychological distress, substance abuse, social isolation, homelessness, exposure to violence. That's something that I just mentioned. Family dysfunction, exposure to racial inequality, history of suicide attempts. So if someone has already made an attempt, then it is more likely that they would attempt again. So those are some of the things that you need to be aware of, so that when you see someone's behavior begin to change, or their talk or their language begin to change, you can be more in tune to what's going on and recommend help for them. We can't force anyone, we can't force adults to take their mental health seriously, but we can be aware of some of the factors and some of the issues and some of the warning signs, so that when we hear them and we see them, we can be a guide to them, that we can encourage them to go seek help and to assure them that it is okay. It does not make them less of a person to be in need of mental health. Just like we would take someone to a doctor who is sick physically, we need to get comfortable with taking people to mental health professionals. And I do mean professionals. I don't mean your cousin or your friend who's not a professional. I'm talking about professionals who could provide the service and the care that is needed to help the person overcome the mental challenges that they might be facing. African Americans have been found to utilize mental health services irregularly, partly due to the limited access and information as it relates to it. And so the lack of services, lack of insurance coverage, the whole stigma, again, as I have already indicated, around mental health within our community. But it's time for those stigmas to be removed, because we need to come together as a community and work together to remove that stigma, to ensure that people who are in need of mental health professionals and services can access them, and access them without feeling guilty or feeling shame because they need to help. So some of the things that are barriers to suicide or helping someone to be overcome, that is one, a strong religious or strong belief system. We know through the research that people who seek to have a higher being or believe that there is a higher being tend to attempt suicide less than those who don't have that relationship with their higher being. And I, as a Christian, of course, would say, that would be the relationship with God based on our salvation through Jesus Christ. But whatever it is, those who have that belief and that relationship tend to not be as quick and as willing to try to attempt suicide. And one of the reasons for that is because they have placed their hope in something greater than them, or something greater than what we can see here on this earth. So that is a very important component. Also, networks, being around people who can recognize and will offer them the support that is needed, is also important. Another one is familiar support. Again, having a family that is around you, that will rally around you and support you and help you when you're stressed and when you're worried, that you don't have to worry about going to them and talking about it because of some shame that you might be feeling. So again, I just wanted to give you some information and some tips as it relates to mental health and suicide, since this is September and it is Suicide Prevention Month. For anyone who is feeling suicidal, feeling depressed, feeling overly anxious, again, I encourage you, your mental health matters. It matters just as much as your physical health. So I encourage you to seek help from someone. And if there's no one that you can turn to, I would highly recommend that you make a phone call. It is anonymous, but these people are here to help you and to guide you and to give you what you need so that you can improve your mental health. And the phone number is 1-800-273-TALK. That is 1-800-273-TALK or 1-800-273-8255. Again, I thank you for tuning in to another episode of Live. I hope that this message will give someone some peace, some comfort if you are going through, to know that it is okay to need help, to seek help. I always ask that you share, but I really ask that you share this because it literally could save someone's life. So I thank you for tuning in, and I'll leave you with words of encouragement as always. Life may throw lemons at you, but you can always make lemonade from it. I say it all the time. It is the challenges in life that strengthen us and help us to become who God created us to be. And so when the challenges come, just know that we've already been given the victory. Thanks, and I'll see you next time.